Good morning. Good morning. Happy Thursday. Unless you're in the Lansing area, I don't know if it's a happy Thursday because we have a snow day today. But I do see my clock just turned to 11:01. I see participants rolling in. So we will give it maybe another minute or two before we go ahead and get started this morning. But thank you to those of you that have joined us today. I will say, for those that are here, similar to kind of what we did last time, if you're able to put your name and the organization you work for in the chat, we would love to see where everybody is from.
Throw in there if you joined us for number 1. This is number 2 of a series. You should have gotten a link to number 1. We're happy to see you back. Thanks.
Love to see that. Looks like most of the folks were at the first session. So Joanne, I don't think we scared them off, which is good.
Not this time.
I'll give it one more minute just because I do see participation is still climbing.
I also don't know, Ella, we just want to make sure that when people can ask questions, they can actually ask questions. I don't know if they can be unmuted or...
They can.
Okay, great. Thank you.
All right, it looks like the numbers kind of held steady. So we're just going to dive right in and get started today. So good morning, everyone. For those of you that weren't able to attend the last session, my name is Megan Gibbs, and I am the Director of Customer Success here at MyHin. And I also have Joanne Jarvie here with me today, who is our Senior Director of Network Growth and Development. So this is our second skilled nursing facility session where we are going to do a little bit of a deeper dive, but if you can advance to the next slide for me, please. I wanted to remind you of who our awesome team members that are here today. And I do see some other MyHin folks has joined here as well. So we have multiple resources that are here to support you. But again, Megan and Joanne are here from the MyHin team. And then we also have Brad Little, who is the manager of the Health Information Exchange section of Blue Cross Blue Shield, as well as Zara Fritz, who is the senior healthcare analyst. So both of them are here today to help answer any questions that you might have. But also we will kind of dive through and do, like I said, a little bit of a recap on what was presented during the first meeting in case you weren't able to join. So next slide, please. Thank you. So like I said, recap of the last meeting, just a friendly reminder of who MyHin is, the Michigan Health Information Network. What does it mean to be a health information exchange? But then we're going to spend a good chunk of our time today diving a little bit deeper into our admission discharge transfer or ADT notifications data exchange solution. So when I say that we're going to dive a little bit deeper, we're going to, again, kind of revisit what an ADT is. But then when we start talking about things like ADT event types, what's the onboarding process? What's the data flow? What are the requirements? We'll kind of talk about that a little bit in greater detail as we kind of roll through. And then as always, please feel free to utilize the chat for any questions that you might have. I do believe that there's also a Q&A button at the bottom of your screens within Zoom. So you can post your questions there as well. And then we also have time at the end for a Q&A session. So without further ado, I'm going to pass it to Joanne to kick us off this morning.
Thanks, Meg. Thanks, guys, for coming back. I'm going to just, so remember, the number one of this session was sort of like a why and a who, right? And we're going to get into the what and the how, which I think that's boring, which is why Megan's doing it. I'm going to remind you of the who and the why. And if you buy into that, then the how and the what is sort of it's sort of the how we make it happen. But first you have to want to. So next slide, please. Next slide. MIHIN. MIHIN is Michigan Health Information Network. We are a nonprofit organization designed to serve Michigan, its people, its health ecosystem, and its governing bodies. We act as a technical backbone infrastructure for Michigan's health data exchange, prioritizing the health of all Michiganders, making sure that not one company, not one body, not one part of the sector owns or controls anyone's personal health information. We are a collaboratively governed body, a state designated entity that sits in between all of the diverse stakeholders, including providers, pharmacies, health plans, community organizations, SNFs. We sit there to securely and privately route personal healthcare information for the purposes of treatment, payment, and operations. And we're here to ensure equitable access to critical information. Next slide. In general, these are the goals of health information exchange. We are looking to, we're really looking to transform how our healthcare ecosystem can improve healthcare outcomes, improve health equity, improve health access, and serve as a shared technical infrastructure in order to save money for the system and for the patients. Next slide, please. We have so here, this is just a quick slide to show you, look, when you share an infrastructure, that means that you can connect once. And by you connecting once and everybody else connecting once, you only have to connect once instead of you connecting with everybody else 17 million times. Okay, so this is meant to explain our hub and spoke model. Let us do it for you. Let us attribute the patients. Let us route to the appropriate care teams, and let us serve the ecosystem equally. Next slide, please. So we in Michigan, we've been doing this for a while. We love it. We are dedicated to our mission. And we have a very generous and really a collaborative ecosystem here, where we work to align policies and financial incentives for real-time data sharing. MIHIN tries to foster this collaboration and ensure that even the smallest providers or organizations can participate in the healthcare ecosystem. What you are doing for your clients is so important to the care teams of these clients. It is so important to the people who are paying for the care. And it's important to be able to evaluate for healthcare operations purposes. We, as a neutral, collaboratively governed steward of health information, we don't create the health information. We help to move it, and we help to make it as rich as possible. In our first session, we went over an incentive that Blue Cross Blue Shield has for their SNFs in Michigan. Brad or Zara, I just want to remind people, like, what's in it for them right now? What's in it for them besides the fact that we think it's the right thing to do?
Sure. Would you like me to talk about this a little bit?
Yeah, just a little bit.
Okay, great. Yeah, thanks. So, hi, everyone. I'm Brad Whittle of Blue Cross, and my team, we're responsible for the SNF pay for performance program. It's kind of it's an offshoot of a hospital pay for performance program we have, but we've designed it to work for skilled nursing facilities. It's pretty simple. It is, and it aligns with our longstanding partnership with MyHIN. And basically what it says is if a skilled nursing facility sends their ADT or admit discharge transfer notifications to MyHIN on a regular basis, they receive a reward. It's open to all licensed SNFs in Michigan that are contracted with Blue Cross. You don't have to do anything to enroll in it. We just take a snapshot from MyHIN. We look and see who are the SNFs that are sending ADTs to MyHIN, and those facilities are automatically enrolled in the reward, which is a 4% increase on the per diem rate for Blue Cross traditional PPO and Blue Card members. So that's the long and short of it. And just a little background on why we do this, on why we have this program in place. It is, while we do have some internal care managers and things that look at the ADTs in certain situations when needed, really, this is largely about just getting a more holistic data set sent to MyHIN. Because when you have that really, really competent, capable, centralized data hub in a state, like Joanne said, if everyone just connects once, if everyone connects to that centralized data hub, then everybody has access to all the data, and it's meaningfully managed by MyHIN. So that's why we want everyone in Michigan contributing to this data hub, including the SNFs. So that's what our program's all about.
Thank you so much, Brad. I should also mention, I don't know if we have another slide for you, but I think that pretty much covers it. And we did cover it in the number one. So if you didn't see it, it's recorded. You got to go. It's amazing. Great.
Yeah, I think there's another slide after this.
Is there another?
Yeah, there's two.
Okay.
And
Next slide, please.
Yeah, so really, this is just a little bit of the details. I won't read it all to you, but basically we do an evaluation twice a year to look to see who is sending. When we tabulate a list of who is sending ADTs, and those in the little chart at the bottom shows you the effective date of the incentive based on the two evaluation dates. So that's how we do it.
Perfect. Thank you. I should note also that our partners at MDHHS have really been looking to make sure that they can help even the smallest providers technically exchange health information. And they are actively surveying all SNFs in Michigan to say, how are you exchanging health information? What do you know about it? Do you know how it can help you? So if you get outreached to about health information exchange in Michigan, it would behoove you to respond, because MDHHS and others are really looking to fund your participation. Next slide, please. Just another what's in it for you. Today and in number one, we are talking to you about sending information, okay? But health information exchange is about the bi-directional sharing of information, which means that you receive, you send, and you can receive. You send and you can access. So just as you are giving people the heads up that somebody has been admitted, transferred, or discharged to your entity, you can find out when a patient has been admitted, discharged, or transferred from any other entity that is connected to MyHIN in the state of Michigan, which is a lot of entities. You can have access to our longitudinal record. You can have access to consolidated care documents, labs, radiology. There is a lot of really critical information being shared in this network, and we not only want you to participate in adding to it, but in taking from it what you need to take the absolute best care of your human being. Next slide. Okay, so that was just a little bit of the who are you guys again? What is, why should we care? We're trying to give you all kinds of reasons to care. And if you care enough, now we're going to talk about how to do it. And I'm going to pass it over to Meg.
Thanks, Joanne. All right, diving deeper into ADT notifications. Next slide, please. So kind of, again, that friendly reminder, what are we talking about when we say that we're talking about ADTs? So ADT is the HL7 standard message for admission, discharge, transfer notifications. We're not strictly just talking about admission, discharge, or transfer movements, right? And you'll see it in a couple of slides that there are numerous ADT event types that support the care that the patient is receiving in the hospital or any single healthcare facility at the point that they walk through those doors up and through the point where they walk out the doors. So these ADT notifications are truly utilized as a real-time notification to communicate what's going on with your patient. And again, it's any time that patient is walking through the door all the way up and through, transferring different floors, getting procedures done, things of that nature, up into the point where they are discharged from that sending or that healthcare facility. Next slide, please. So when we start talking about participating in Blue Cross Blue Shield's P4P or Pay for Performance Compliance program, there are some requirements to be able to participate and to ultimately receive those incentives. For those net new participants, we want to make sure that you are in great legal standing with MyHIN. So we do have a legal chain of trust that we follow. And that's something that one of your account managers can talk to you more in depth about if you have any questions. But really, we want to make sure that we have the appropriate legal agreements in place to support exchanging patient data. Once we get through what we call those initial pre-onboarding steps, is when we kind of start getting to the nitty-gritty of the technical piece of it, right? Your actual onboarding process. So we want to make sure that your organization is sending those ADT notifications in real time. Especially because we know that Blue Cross Blue Shield looks at a traffic report. And so reviewing that traffic report determines and helps the Blue Cross team make sure that you are receiving that incentive should you meet those compliance requirements. And then we also want to make sure that you're following kind of, I say rules and regulations, but really making sure that we are exchanging data per our implementation guidelines or our requirements, making sure that the information in those ADT notifications is beneficial to the downstream receivers. And of course, for the existing participants, I believe those that fall into the existing cohort have been actively sending at least for 6 months. But we just want to make sure that you continue to send those real-time ADT the real-time ADT notifications to MyHIN, and also continue to adhere to our ADT specifications. Next slide, please. So I think this was also kind of touched on during our initial meeting, but what are some of those innovative uses for ADTs, right? Why are they important? Why do people care? But it's ultimately knowing, especially from the skilled nursing facilities, what's going on with that patient. So we had been hearing for years from our downstream receivers that they really wanted the skilled nursing facility ADTs. They wanted to know what was happening with their patients. MyHIN gets ADTs from, I would say, 99% of the hospitals in the state of Michigan, but there was that gap in knowing what was going on with the patient at the skilled nursing facility. So I think there was another slide earlier that it also ties into medication reconciliation management, understanding if there has to be any follow-up for specific patients based on their time at the hospital, let alone at the skilled nursing facility. But really, the innovative use here is care coordination and making improvements and reducing costs, right? We want to know what is going on with that patient at all times to make sure that we're giving them the adequate care that they need. Next slide, please. So kind of what I mentioned earlier, that when we talked about ADT notifications, there are up to 62 ADT event notification types. So you can see them all listed here on the screen. MyHIN does not discriminate against ADT event types. So if you have it, send it. We want all of it because we do route that data outbound, and our downstream receivers do care to receive these ADT event types. The ones that I have bolded in blue are more widely known, more widely utilized, maybe looked at a little bit more frequently. But that's not to say that we just want to receive those ADT notification event types, right? If you have it in your system, send it, and we'll make sure that it's being utilized by your downstream receivers at all times. Next slide, please. So I'm going to do a little bit of a deeper dive into the actual onboarding process, but I do want to preface here that These slides are high level. And so should you get to the point where you do meet with our customer success team to actually go through the onboarding process, you will see some of these slides, but we're also going to spend a good chunk of our time doing that deeper dive, again, deeper than what we're kind of talking about here today. But you will always have resources available at your disposal. MyHIN has a ton of support documents that we can help walk you through this process to really kind of make it as streamlined as possible. So next slide, please.
Let's just wanted to remind people that probably you are going to have to engage one of your technology providers on this, okay? Unless you're really in the technical space, you are going to have to identify which system is capable of sharing this type of information with the Health Information Exchange. We have invited a number of technical vendors to this engagement. They also were at number one. So if you have any questions about, like, you know, who is your source system, we can work with you on that too. It might be that you just don't know, or that you might not be the right person to move through the onboarding. You've figured out that you want to do it. You understand it completely from a clinical or operational perspective, but technically you might need some help.
Thanks, Joanne. Okay. So if you're like me at all, I'm a very visual person, right? I want to know what I have to do to get from point A to point B. So we provide you with there's two slides here about the path to production. And these are some of the key milestones that you have to work through with our customer success specialist as part of the onboarding process. So that first pre-onboarding phase is where you will engage with your account manager to go through and understand the legal agreements that you might have to execute to participate with MyHIN, really kind of setting the tone for that understanding of here's what's all going to happen as part of this onboarding process, right? And then once we work through that pre-onboarding phase is when your account manager does the handoff to our customer success team. And one of our customer success specialists schedules what we call a kickoff call. So those are traditionally 30 or 60-minute meetings where we do a very in-depth overview of everything, right? Here's the documents that we need from you. Here's how you complete those documents. Here's why we need those documents. This is what to expect at each part of the onboarding process, all the way up until production, but even also post-production as well. And then after we kind of work through that kickoff meeting and we share something that we call a care package, our customer success specialist then initiates what we call the onboarding, or phase two, right? So it's really diving in and getting some of that technical work done. We work to establish connectivity between the two systems if you're not already, if your network is not already connected to MyHIN. We work through completing the required documents. And then also as part of that, it might be, yep, on the next slide for me, please. Once we get all of that network connectivity established, we do have our testing process, right? So we'll work with your organization to exchange test data. And really, we want to make sure that one, the systems are talking to each other. Two, the messages can be exchanged without any issues. Everything is formatted okay. Everything's showing up in the right section. And then once we get through all of that and we can start checking the box to say, okay, everything's working up to this point, we schedule what we call a go live call. And that is usually a 30-minute meeting where we have all of our resources there in case we do need to troubleshoot, but we essentially flip the switch, right? So we start receiving production ADTs from your production environment. And then after that, kind of touching on it today, I think this is going to be a little bit of a phased approach, but we'll start to explore DQA, or data quality assurance, which I'll get into in some later slides. But we really want to provide you with the support that you need to take a look at your conformance reports to make sure that you are meeting the conformance requirements. So you do receive that incentive from Blue Cross. Next slide, please. So when we start talking about the onboarding process of sending those ADTs inbound to MyHIN, this is kind of, again, I think there are two slides that we shared in our first session, but just again, highlighting what the process looks like and what MyHIN does when we do receive those ADTs. So your skilled nursing facility sends the admission ADTs or, any subsequent ADT event type from there. What MyHIN does on the back end is we look at that ADT and say, okay, so we received an ADT for Anne. Who is member or who's a part of Anne's care team? So we identify all of the healthcare professionals that are actively providing care with Anne or have what we call an active care relationship. And then we also look at to determine how those healthcare professionals want to receive the data. Do they have it set up through direct secure messaging? Do they have it set up through a VPN, right? There's all sorts of mechanisms to use. But once we identify all of that information, we route those ADT notifications real time into members to the members of Anne's care team. So what I just kind of talked about here is done in less than a second. It's extremely fast. And that's why we say that we want to receive the ADT notifications in real time to make sure that we're pushing those out in a timely manner to the downstream receivers. Next slide, please. So just like the inbound, when Anne is initially admitted to the skilled nursing facility, right? It's going to be the same thing as when she's discharged or any sort of patient updates throughout her time spent at the skilled nursing facility. So the same mechanism applies, right? We receive the ADT, we determine who still has that active care relationship with Anne. How do those healthcare professionals want to receive the data? And then the data is routed outbound, again, all in less than a second. And so MyHIN's been around for numerous years. And at this point, I think we've exceeded, if not reached, like 1 billion messages. So ADT messages are flowing at a high rate all the time. But again, this is so important because our downstream receivers wanted the skilled nursing facility ADTs so bad, right? They wanted to make sure that they were still being able to follow their patient's care as part of that. So next slide, please. One of the key things that we'll do a deeper dive into during the kickoff call, but I wanted to introduce today are what we call object identifiers, also known as OIDs. So I know Michigan is a little bit unique as opposed to the rest of the nation, because I don't know if the rest of the nation heavily utilizes OIDs like MyHIN does, but think of it as a unique number to an attributing sending source. So it really is a unique string of characters or numbers that are used to identify a single location. So no sending source has or shares the same OID with another sending source. So I'm getting a little bit technical here, I understand that, but if you know or are familiar with the data setup of an ADT, MSH, which is the message center, I'm specifically talking about MSH 4.1. So that is the unique sending facility ID. MyHIN can work with your organization that if you don't have an OID or if you're unable to send OIDs, we're able to do that transform for you on our side. So we kind of take that work away from your EMR vendor to be able to support you from that perspective. But also if you are working with us and you say, I have no idea what an OID is, I don't know if I even have one, we have the necessary resources on our team to look at various resources to determine if you do have an OID. And if you don't, MyHIN can work with our health system testing repository, also known as HISTR, to create an OID free of charge. However, there is also an option to utilize HL7's OID registry to create a nationally recognized OID, but there is a fee associated with that. So again, I just kind of wanted to call this out as a preface because this is something that we do require as part of our onboarding process. But again, we have resources at your disposal to walk you through any specific questions that you might have pertaining to OIDs. Next slide, please. So the reason I preface with that is because you will see that the OID is a requirement for both the sending facility and also the managing organization. So the best way that I can explain what that means, and I don't know if anybody from Mission Point is on here, but I know Mission Point has multiple facilities at various locations, right? So if I'm going to pick on making this up, Mission Point Lansing would have their own OID, and that would be populated in 4.1. But Mission Point, overarching, right, managing organization has their own OID. That's what you would find in MSH 4.2. But aside from identifying those facility identifiers, because again, the downstream receivers want to know exactly where their patients work, there are several data sets that would need to be included in the ADT notifications. So What you see here on your screen has been identified as part of the P4P program, but then also a mixture of what MyHIN requires based on feedback from downstream receivers. So again, we will work with you as part of this process to make sure that the data is showing up on the mapping table. It is showing up in the ADTs themselves. And I feel like we might have just had a technical disruption here. So I'm going to share my screen real quick to pick up where we left off. So give me one moment. I feel like I should be used to it by now as to knowing what screen I'm going to share. Let's see here. I want to share. Sorry, give me 1 second here. Okay. So I talked about the data elements that are required for participation. But aside from OIDS, we also have this super fancy tool, or more or less, I think it's like a glorified spreadsheet, but we call it a mapping table. Mapping tables are important because MyHIN does the work for our downstream receivers when I say that we normalize data. So first and foremost, a mapping table is used as basically this, it's a table of telling MyHIN corresponding values and what they map to based on your unique EMR systems. So what I mean by this is that, let's say skilled nursing facility A sends the value of W for white, skilled nursing facility B sends white, right? But we all know, but MyHIN will map that back to the standard HL7 value. So we don't have to tell the downstream receivers that they have to code their systems in a way to accept values from over 1,000 senders, right? MyHIN takes that work on behalf of our downstream receivers, which is why these mapping tables are so important. This is also something that one of our customer success specialists will work with you on how to actually go through and complete that mapping table as part of your conformance. So not only is the conformance program looking at the actual data that's coming through your messages, but we want to make sure those values are mapped specifically for the purposes that MyHIN can work to normalize the data and take the burden off of our downstream receivers. So this is an example of what our mapping table looks like. Again, it's a very large spreadsheet, but we broke it down into the different ADT sections, and then we really just want to know what those values are. So similar to what I shared before, if you're sending F for female, we would have an F here, but if you're sending F and then maybe FE, both of those values would be accounted for. So MyHIN can normalize the data for the downstream receivers, but then also we know what data to expect from your systems to kind of help with that. And then if we do get questions, we can always refer back to these mapping tables to address any customer questions, but also our customers have access to these mapping tables. So we want to make it shareable so everyone knows the values that might come through in those downstream receiver feeds. You know, it looks scary, but I promise they're not. So when we kind of work through that whole onboarding process, right, pretending that up to this point that your organization has entered into a production status of sending those production ADTs to MyHIN, this is where I think we start to dabble in what we're calling phase 2 of this approach. So we want to get the data flowing, and we want to get it flowing into production, but then we also want to make sure that you're able to review your conformance scores to ultimately receive that incentive. So this is where we enter our DQA, or data quality assurance period. So at this point, we have multiple resources available, along with a tool that I'll show here in a minute, called the MyGateway Conformance Module, where you will be able to identify users from your skilled nursing facility that they can log in and play with different filtering options to review conformance scores at any given time. So if you're thinking, okay, great, right? I'm sending ADTs to MyHIN, they're flowing through the production environment. How do I know what my data looks like? How do I know if I'm meeting the conformance requirements for Blue Cross? This is the tool that will help you out. So upon logging in, this is what would be displayed. And so I think this view might be a little bit different for everybody depending on your settings, but you will have the ability to click into the MyGateway Conformance Module, and you'll have access to various reports. So there's 3 separate reports that you have access to based on my screen here. So the ADT conformance report for SNFs is what those users would click on to review their conformance scores during a specific time period. The ADT mapping table analysis is a analysis based on the mapping table that you provided to MyHIN, and we do a crosswalk to determine to say, okay, all of the values that are provided in that mapping table, are they coming through in your ADT notifications? Are there any values that are coming through in your ADT notifications that aren't in your mapping table? So depending on where your thresholds are for conformance, you can look to determine if you are meeting the conformance for the mapping table. And if not, the analysis will show you, okay, so here I sent this value over 200 times, but it's not in my mapping table. I know that's what's bringing my conformance down. So I got to go back in and add it. So you have that at your disposal. And then we also provide you what we call ADT fallout examples. So this is for any user that has access to PHI, and that's identified when we create your account. But more or less, you can click into this and say, show me all of my ADTs that are not meeting the criteria for this specific segment, right? So if I'm just going to pick on patient first name, I see that I'm not meeting conformance for that specific field. I want to dive deeper and to figure out what's going on, right? Do I need to talk to my staff? Is it something that's going on my interface level, right? We have resources to help with this as well, but you can really hone in on figuring out why your conformance score is dipping, but also why your conformance score might be dipping during a specific time range or on a specific day. So once you do log in, so pretending here that I clicked on that first option of looking at my conformance report, right? Like I mentioned, there's a bunch of filters that you have at your disposal, but let's say this is what my conformance report looks like, knowing that my skilled nursing facility began sending ADTs maybe at the tail end of May. So I do want to make it known here that you will see facility names here, but for today's call, I wanted to make sure that it was general baseline, like didn't want to call anybody out. But you do see your facility names listed there. So if you, again, are somebody that might work at Mission Point and you need to have access to multiple locations, you'll see the multiple locations listed under the facility group section here. But also, you can see the specific ADT event types and whether or not they're meeting conformance based on those specific fields, right? So if you see green, good news, great, right? We still want to pay attention to them, but we know that that's not where our immediate attention needs to be. Anywhere that we see red, we know that our organization or skilled nursing facility is falling out of conformance for that specific message type, right? So the way to interpret this is that if I know for my AO1s or my admits, I'm not sending, I want to say IN13 is, I always get it backwards. I can't remember if it's the insurance name or the value for it. But I'm not sending specific insurance information, right? And we want to make sure that that information is there. But I do see that I am populating IN14 50% of the time, which is good, but that's also a score that I might want to increase, right? So I want to see the green for that. And any time where you don't see a color at all means that MyHIN isn't getting data for that field in that specific ADT event type. But again, not meant to be scary. We have resources that will help walk you through this, but we do want to showcase this is what it would look like to help your teams determine if you are meeting conformance. Now, if I review that report, right, that's what it looks like during the month of June, and I deploy resources, I invest my time, I actively monitor my engagement, this is what the reports can look like. I have seen multiple organizations do this, especially when MyHIN was working with Blue Cross as well as our hospitals and health systems back several years ago, that when we first started this, the intent is similar today, right? Let's get the ADTs flowing. And then we kind of got to the point of, okay, ADTs are flowing. Let's take a look at the conformance, right? And we saw significant increases over time. So this is something that we have resources to help you with. We can help monitor and help guide you where you need to look at specific followed examples, but it is possible to increase your conformance overall, right? The green is what we want to see. We understand that there might be some red sometimes, but ultimately we want to make sure that you are meeting conformance to get that incentive from Blue Cross. And again, so everything that I kind of talked about in the beginning is that technical work that would have to happen up to the point of exchanging the production messages. And then the DQA, my gateway tool that I presented here is part of that phase 2 approach of, okay, the data sending, how do we make sure that we're now in conformance with what it is that we are sending to MyHIN? So what's next? right? How do you get engaged? How do you check in with the MyHIN team to see if your skilled nursing facility is actively sending ADTs or not? You can always write to your account manager. You can write to Joanne, myself, or Brad if you have any specific questions about Blue Cross incentives, the program in general. We are here to help. And then you can always reach out to our help desk. You can send an email to help@myhin.org. And that will generate a ticket within our system and it will be routed to a service desk where someone will reach out to you. You can log a ticket through our portal, right? There's multiple means where you can reach out to MyHIN to kind of engage in that next step. And like I said, we're happy to help. And so I do see that there were a handful of chats that came through. I'm so sorry, I haven't been checking those out.
Mostly, I mean, so
Okay.
there's been some questions. Let's see. There's been some good questions about, you know, if a patient leaves a SNF and the patient ends up going to a hospital that is not, you know, necessarily usually engaged with that SNF, or if they're not in the same health system, could the SNF receive that information? And I said they could. That's why we exist. There are questions about when conformance will be kicking in for the SNFs, you know, trying to understand first, we're just making sure that everybody's sending. And then as we move down this path, we will be working with all of our senders. Every sender to MyHIN, we are going to be working with on their data. We need the MyHIN data to be as rich and as clinically useful as possible. So Meg, I don't know if it says in the guide for SNFs, you know, specifically how they will know if they're reaching conformance, but I know that this is a way to introduce people to start looking at what data they're sending and what information they are actually including. So if you want to talk a little bit more about that, that was what was being discussed. Kate Olds, please, as always, feel free to come off mute and chat. I see you've been very engaged, sort of writing while we've been talking. Belinda, for organizations with multiple locations, is it a generic contract or one per facility? Belinda, I don't know if I can answer this across the board. Whoever has the legal right to say that this entity can share health information in this way will be the entity that signs our legal contract. And if that entity can cover many of their practices, many of their SNFs, that's great. And if it has to be each facility, it may have to be each facility. There has to be a legal chain of trust. How do we log into the site you displayed to check out our performance? Monica, this is a tool that MyHIN provides. It's called My Gateway. And we are happy to introduce you to it. We have been going through a very long process of sort of migrating and updating this tool. But again, when you decide that you want to participate in this way, Megan's team will introduce you to the tool and how it can be used. There were a lot of people on our first call that were sort of like working through, like, yeah, like I want to do this. This sounds like something I want to do, which is fabulous. That means we've done some of our job. But you were also kind of saying, like, if I press this button, like, does it do it? And it's not like that necessarily. It's not totally how it works. And I really, really want to impress upon you that you should be working with your source systems, or have your source system reach out to us, and we will get everybody in the room asking and answering all the right questions. Another reminder and plug that MDHHS will be sending out surveys to try and figure out how much your entity or facilities know about health information exchange, what you are currently participating in, why are you just sending, why not receive or access, and what are the barriers to entry for you. The Blue Cross Blue Shield conformance standards. Cheryl, I don't know if the P4P guide is directly on the website. Do we have, Brad, do you know if it's available publicly on the website, or if you could send it out, or if you'd like
It's
for
not, Joanne, but I'm working on it. Hopefully, we can open a spot on it, so it would
do
be
you
publicly
want
available.
me to attach it to now, or would you rather follow up?
I can do attach it, like.
Great.
And I just want to add to that, you know, to Joanne's point earlier, right? Bringing in your technical resources, bringing your vendors to these conversations. That is something that we do reiterate as part of that outreach that we do when wanting to schedule that kickoff call, right? We get a lot of questions of who should be on this call. Well, bring everyone, right? Bring your technical resources, bring your EMR vendors. It's always good to have that collaboration and communication amongst everybody, so everyone has the same shared understanding of what it is they need to do and how they need to accomplish that. But always, right, if your technical team isn't able to join, your resource can't join, that doesn't mean they can't reach out to us and ask questions, right? We're always happy to schedule a follow-up meeting with them specifically to address any questions that they have. But if it gives anybody comfort, I can tell you that we've worked with most of, I don't even know, over 50 different EMRs, right? And I think that number should even be a little bit higher, from all of the known EMRs today, all the way through to homegrown EMRs, right? So we're happy to go through this process with you, even alongside your vendors as well, that, you know, they're pretty experienced in a lot of the work in supporting your hospitals and other healthcare organizations as well. But again, we're here to support you along every step of that journey, but then we also make sure that you know where you're at in this process, and then what you have to do after you begin sending production data to MyHIN. Are there any other questions?
Yes, Travis, we will send out the slide deck. We will put the slide deck always on the website along with the recordings. We have a number of our engagements on there under the download or bits and bytes. But also we should be sending out to all of the people who registered, number 1 and number 2.
Looks
How much
like-
progress is being made to include CBOs in the data set? Well, Benjamin McGuire, do you have a good year and a half to talk that through? Community-based organizations, I'm going to make this very short for us. MyHIN has been working for a very long time to exchange information cross-sector. When we say cross-sector, we mean outside of traditional medical health care. The technical issues between connecting with a community-based organization are the least hard to overcome. Right now, what the state is doing and what MyHIN is doing is looking at if community-based organizations fall under the HIPAA structure. If community-based organizations are working with their patients in a way where they must, you know, get consent to share that type of information. So it is the right question, and I wish there was a simple answer, but I will say that we are working to make it so that next year or the year after, we have just these types of engagements for those that are working in the community. We have a good, yes, CIA advisory. Yep. So you know, when you know, you know.
I also saw the message come through from Sarah regarding our update with MyHIN's relationship with Point Click Care. So yes, just last week, I believe, it's already crazy, that's February. MyHin had a extremely successful and impactful go live with the Point Click Care team on the 29th. So we onboarded 110, I think, skilled nursing facilities to send ADTs to MyHin. And so that is part of that two-phased approach where we wanted to get the ADT production data flowing. And now we're having those follow-up conversation with our partners at Point Click Care to determine, okay, what's next steps in terms of monitoring performance and things of that nature. So I anticipate a further update will probably be available in the near future. I know we're still doing some small work following that go live. So yeah, I guess I would just say that more information will be available soon after that too.
So Zara from Blue Cross Blue Shield did post the pay for performance guide for SNFs in the chat. That's your way. That's your way to get it. That's one of the ways to get it. Like gold, go grab it. Listen, if you're new to this, there's no, like, we were all new, and then you're going to start seeing the world in a different way. But write us, call us. There's no question. If you don't want to ask it now, that's cool. We're here. And for those of you who are very advanced and who have just come to see how we explain this, we're trying to take it step by step. Thank you so much for coming. Please come back.
Thanks, everyone. Have a great rest of your week.